Hi there, this is Jen, the Medicare Educator, and today I'm going to walk you through how to find a Medicare Part D drug plan. It's very easy to find this. So we're going to go through the steps on how to find a drug plan, and this is going to give you the idea of the cost of your medications for the year, and it's going to allow you to enroll in a Medicare Part D drug plan. So you're going to go to Medicare.gov. When you get to this page, you're going to scroll down a little bit. We're going to go down to this section, Find Health and Drug Plans, and click on the Find Plans Now button. So you can log in if you already have an account here. If you would like to, you can click here and create an account, and this will save this information to your account. You can also continue without logging in over here in this section. That's what I'm going to do. And so you want to make sure 2025 is chosen. You're going to put in your zip code, and if it asks you, you can select a county. Click on Continue. We are looking for a Medicare Drug Plan Part D, so you're going to pick this middle button, click on Find Plans. And then, do you get help with your Medicare health or drug costs? Most people don't have any of these things, so we're going to choose I don't get help from any of these programs at the bottom. Click on Continue. Do you want to see your drug costs when you compare plans? Click on Yes and click on Next, and then it's going to have us put in our list of drugs. So you want to make sure you have your list of prescriptions ready with the dosage and the quantities that you take. So I'm going to put in some medications here. And when you start typing in the word, it's going to give you a list of things to choose from. So you just click on the one that you want. Click on the Add Drug button. Now, when you type in a brand name, it's going to give you this option to keep the brand here or to add a generic so that it can show you lower costs. So I'm going to click Add a Generic. You want to make sure you have your correct dosage chosen. We're going to leave the frequency at every month so that we have an even comparison across the board. So even if you get something from a mail order pharmacy where it's going to give you a 90-day prescription, we still want to choose every month just so we're comparing apples to apples as we do this comparison. When you have your drug listed here, added, you're going to click Add to my drug list. It's going to add it to your list. I'm going to add a couple of other ones here. So Lipitor, click Add Drug. I'm going to add the generic, but again, you can keep the brand. Make sure you choose your dosage, Add to Drug List. Add Drug, Add Generic, Add to my drug list. I'm going to add one more. So this drug is an inhaler, so it has a couple of different things that you need to make sure you choose to have the correct drug. Add it to my drug list. So you see all of the drugs that you've added here. Now, when you get finished adding your list of prescriptions, you can scroll to the bottom of the screen and click on the Done Adding Drugs button. And it's going to show you a list of pharmacies. So here it says choose up to 5 pharmacies. Now you can see here that it has the zip code that you put in. So you do not need to enter a location. You do not need to enter a pharmacy name. Okay. This by default is choosing a distance of 5 miles from your zip code. You can change this to a longer distance if you like. And it's going to give you a list of pharmacies that we can compare. So we want to choose mail order pharmacy. We want to always choose a Walgreens because they are plentiful and they're everywhere. We want to choose a CVS pharmacy. And then you want to choose a grocery store pharmacy, so a Publix or a Kroger. And then we always want to choose a Walmart. So we're going to have to look through different pages here to find where Walmart is on the list. Okay, here's a Walmart. And then you can see we could choose up to 5. You can see the 5 on the bottom of my screen here. These are the 5 we've chosen. And you can click the Done button. And it's going to show you the plans that you are eligible for. It's automatically going to sort these by the lowest drug and premium cost first. So automatically, this is the least expensive plan for you. So it gives you a little summary of all of this information, your monthly premium, It gives you the retail pharmacy cost, the mail order pharmacy cost, your deductible per year. We can click on the plan details button to get some more information. Okay, so again, it shows you this kind of summary of what your premium is, what you'll pay retail pharmacy, what you'll pay mail order pharmacy, and you can see that it shows here that it covers 4 of the 4 drugs that I put in. So you want to make sure it covers your drugs. And again, you have some summary information here at the top. As you scroll down the page, going to drug coverage, it's going to list the drugs that you put in. So you want to make sure you have the correct list of drugs. If you scroll down a little further, it's going to show you the pharmacies that you chose to compare. Now, this is important because you can see that some of these are preferred and in network. And you can see here that CVS is in network, but it's not preferred. The preferred pharmacies are going to give you lower costs for your drugs. So you want to make sure that you shop at preferred pharmacies. So if you scroll down a little further, this is going to break down your yearly drug costs by pharmacy so you can see what you would pay at each pharmacy that you choose. So you can see again that these 3 are preferred. CVS is in network but not preferred. Mail order is preferred. So you can compare the prices here. You can see that for these individual medications that the CVS in network is going to be much more expensive than the preferred pharmacies. If you scroll down a little bit further, it's going to show you the drug plus premium cost for each pharmacy. And again, you can see how much more expensive the in-network pharmacy is versus the preferred pharmacies. It's also going to tell you when you will meet your deductible. If you scroll down a little bit further, this just breaks down your spending by month for your prescriptions. And then you can expand to these, see the details of these pharmacies if you'd like to see the costs before and after deductible and that kind of information. If you scroll back up to the top, you want to keep a copy of this information. So you can click the print button. You can save it as a PDF, save it to your desktop or print it if you would like. And you can also enroll directly from this screen. So if you click the enroll button, it's going to show you here what information you're going to need in order to enroll in the plan. So you need your Medicare number and effective dates. You need other health coverage information if you have other health coverage and dates that things take effect. You can click join plan and you will need your Medicare number right away. Read the page to check the box and click next, and then just follow the prompts through the screens and it will let you join. Now, if you are not making a change from last year, you don't have to re-enroll, but this is how you would enroll in your drug plan and find the least expensive drug plan for you this year.